Hey love, so I'm going to make a really quick video. One of my followers, she asked me to make this video for her, and because she is a loyal follower and a sweetheart, I'm definitely going to make this video. So what I'm going to do is first I'm just going to give you guys the very basics, and I'll work on some questions to actually post so that you guys can actually practice them in another video, and then we can go over like getting into detailed actual calculations. Now, I didn't want to make these type of videos only because I don't claim to be an expert at anything. You know, these are just really my opinions for school. But if I'm going to make videos to help people through the journey, then, you know, I should do things that, I should make a video that shows you what helped me go through it. So my follower Red, the Educated Beauty, hi love, asked me to make this video, so I'm going to do this. I'm going to do it in a few parts. I haven't really thought about this a whole lot. I'm just trying to make this video for her to help because I didn't know when she needs it. Her first question is how do you pass checkoffs? And what I think she means is the vital signs checkoff. So pretty much you have to know your basics, and there's just no way around it. You need to know vital signs. The best way to remember is first figure out what your school considers to be the range. Every school is different. When you go into hospitals to chart signs, you'll see that their ranges are different. So you need to figure out first what their range is, okay? For our school, for breathing, it was between 12 to 20 breaths per minute. For heart rate, it was 60 to 100 beats per minute. And then there's temperature. So you know that there's a different temperature between oral, axillary, and rectal, okay? And you have to know the differences between that. And first thing I could recommend to you, one of these quick study guides, okay? And here it has like assessing lung sounds, the EKG, heart sounds, all that stuff, okay? But this also shows you how to give injections, which cranial nerves, pressure stores, stages, where to give injection sites, like if you're gonna do the deltoid, if you can see that here, dorsal gluteal, vastus lateralis, which is this one, ventral gluteal, Z-track method, all that stuff is there. It also gives you how to do IV flow rates and conversions, which you need to know, and I'll go over that in this video. So it gives you everything, and I actually have a few of these. This one is just like nursing, like once you get a little bit more advanced. And I also have the medical math. I absolutely recommend getting this. Everybody thinks that math is easy in nursing school. You know, you think it's a basic because you start off with like little things like, oh, if you have a 120 milligram order and you only have 40 milligram available, how many tablets would you give? You give 3. So you think that's easy, right? But then they start throwing other stuff in there. So get your math down first also. But as far as vital signs, if you don't want to spend money on these, another good tip is Pinterest. And this is what I got. Let's see if you guys can read that well. So for instance, it says here heart rate is 60 to 100 beats per minute. Respiration is 12 to 20 breaths per minute. Then systolic blood pressure is anything below 120. Make sure you know what systolic blood pressure is, the difference between systolic and diastolic, which one is the higher number, which one is the top number, which one's the bottom number. Know the temperature. So for a temporal artery, so where do you guys think that would be? Temporal artery? Temporal is going to be across the head. So temporal is going to be 98.6 to 100.4. Tympanic is going to be 98.6 to 100.6. Oral is going to be 97.6 to 99.6. Rectal is 98.6 to 100.4. Axillary is 96.6 to 98.6. So there's no way of trying to remember certain ones. You just have to just keep practicing and just, you know, get it down. But make sure, and I don't want to say like stick to the numbers I gave you, find out what your school wants you to know for the range, because some people will put, if you may look up something and you may see 8 to 20 breaths per minute is normal, whereas our school, if you see 8 breaths, we consider that bradypnea, which means slow breathing. So not only is knowing your vital sign, the ranges, important, but you need to know the terms that correlate with it. If a person has a heart rate between 60 to 100, we consider that normal, okay? If their the heart rate is below 60, then bradycardia. If it's higher than 100, which means a fast heart rate, that would be tachycardia. Now this is very similar to breathing, your respirations. Normal is between 12 and 20. Anything below 12 would be bradypnea, slow breathing. Anything above 20 is, anything below 12 is going to be bradypnea. Anything above 20 is going to be tachypnea, fast breathing, okay? As far as your vital signs, just know your numbers and know the terms that relate to it, okay? As far as passing for a test, practice, practice, practice. So you practice on your sister, you practice on your mother, you practice on your boyfriend, ex-boyfriend, whatever. Anyone who will let you practice on them. I was lucky enough to have nursing friends, so they would allow me to go over it and just do, they would allow me to do their vital signs. And so sometimes they would go running and they wouldn't tell me, and then they would sit down really quick and then they were like, okay, take it. Or they would like breathe really fast and then they say, all right, like, now guess now. So you ask, even if you can't get your family to do it or they don't want to participate, ask your other nursing school friends to, you know, do something to change their vital signs, being safe, of course, so that you can guess it. At our school we have dummies or robots or whatever you want to call them, and they're able to control it with a computer, and they change the rates, and sometimes you'll get a number that's really, really high, or sometimes you get a number that's low. And it is important that you're able to listen and hear everything and you pay attention. So if you're gonna do that, you always have to have a wristwatch. Do not forget your watch on test day. I repeat, do not forget your watch on test day, because that will automatically be an issue. People will say, oh, there's a clock on the wall. Clock may be wrong, clock may not work. You may not even be able to see the clock from how far away you are. Have a wrist watch, not a digital, always the secondhand ones, okay? So know that. So in order for you to get good, practice. Pulse, for me, I find it to be pretty easy to read. On adults, babies, whole other story. But for me, and you take your 2 fingers. They say never to use your thumb because your thumb has a pulse in it and you could actually mistaken your pulse for that person's pulse. Take your 2 fingers, you run it down your thumb. This is radial, okay? And then you find it just about here. Now everyone's a little bit different. I can always find mine. And it's, I don't know if you guys can see that, right there. So if I was to count, I'm looking at the time on my camera. I'll just do, oh, first of all, you do 30 seconds. If the pulse is ever irregular, then you do a full minute. That was 30 seconds and I got 42. So that means for 30 seconds, 42 beats happened. So then you need to times that by 2 so that you're at a full minute. So that means 84 beats per minute, okay? So that would be my heart rate right now. Now my heart rate does vary. I just got up, walked, and then came back really quickly to plug my charger in. So my heart rate is generally somewhere around 70. So that would be another tip for when you're doing a checkoff, is say if you're using your nursing school friend and you always do it with them and their heart rate is always 76 no matter what, as long as they're sitting, stuff like that, and you get a heart rate of like 40, this is what you say, okay? You're gonna say, if you feel unsure, say 1 second, please let me take that again. I felt like it was a little irregular. Now you count for a full minute. You don't ever want to say you don't know or you're not sure or get flustered and get worried. No. Breathe in, breathe out. Can you just give me one more chance? I'm gonna actually try to feel her other side of her other wrist, or I'm gonna place my fingers a little bit differently. I felt it was a little irregular, and I'm gonna count for a minute. Because now they understand that you understand that something was irregular, something was off a little bit, and now they're gonna do it. Now our school, what they did is that they put out our partner's hand. I would take one wrist, my teacher would take the other wrist, and she's feeling for the pulse at the same time. So you better know it. If their heart rate is really, really high, you can attribute it to just being nervous, okay? So my friend, she did my heart rate, my blood pressure, and my blood pressure is normally 120/80. This time it was like 140/90 or something like that. And I was just freaking out nervous because I knew I was going up next, and I was like scared. I didn't want to mess up, and my teacher was like, calm down, you know, it's okay. Like, and I wasn't even the one being tested. So my poor friend thought that she was reading my blood pressure wrong because she was so used to it being 120/80 that she thought she messed up. And really, in reality, it was just that I was nervous. So because I was stressed, my blood pressure went up, and you know, so you have to make sure that you're confident with what you have. So if you get a number, don't second guess yourself. If you feel like when you're done and you felt the pulse, you took the blood pressure, and you're like, I heard those 2 sounds during the blood pressure, I know for sure, go with it. Don't second guess yourself, because if you give your time to think, yourself to think, you're gonna think like, oh my goodness, maybe that's wrong, her numbers are really 120/80. That's not necessarily true. She could be nervous, he could be nervous, and then that can completely throw your number off. So be confident in yourself, okay? That's really important. Another trick that I do, everybody may not agree with this, but it's always worked to my advantage. I want to go first. When they say who wants to go, me. I want to go, for one, because it shows that one, I'm ready to go. 2, I don't want anyone else saying anything to mess up my numbers that I'm thinking in my head. People will so often be like, oh, so wait, so what is the respirations? Is it 12 to 22? No, I heard it's 8 to 10. No, it's You go in with the numbers that you know are right, and you go in, you take that test, you don't allow anyone to get in your head, and you do it, you pass it, and then you move on, okay? So do not wait to be the last person, because you will hear everybody complaining about, oh, I didn't pass, oh, it's this number, oh, she did this, oh, she did that. It will completely mess you up and throw you off your game. Go first. And it's always worked to my advantage. Every time I've had any kind of test, I've always gotten an A. So I will stick to it. I will always be number 1. In fact, I get highly annoyed if someone raises their hand before me, because everybody knows I like to go first. So it's like, put your hand down, I'm going. So that's it for that. Pulses, as far as your carotid, you can. I think the best thing, and what we do in school, is radio. If your teacher sees you go like this, you take your 2 fingers and you put it on the pinky side, you automatically failed. That's it. There's nothing to even talk about. Don't even say I'm gonna start here or move over. No, because there's no reason to be over on this pinky side. That's, you know, that's not radial. Here, thumb. Go along the curvature, down. You will find it right here. And I can feel my pulse. Okay? So when doing a blood pressure, 2 things that you need. 1, a blood pressure cuff. 2, stethoscope. First and foremost, these earbuds, see this? Always should point forward, okay? If you put it in like this, it is wrong. You won't hear anything. Earbuds, go forward, okay? Another rule of thumb, and I don't know what this is for your program, so make sure, our school, some instructors don't care if we wear it around our neck like this. Some instructors do not like it at all, so they want you to wear it like this. Some have a complete issue with it and they want it in your pocket. So know your instructor. If you know your instructor has a problem with you wearing it around like this, and you come to take your test and you have it like this, they may fail you. Why? Because you know you're not supposed to have it around your neck. The issue with it being around your neck is that it's dirty. You put it on your neck, then you touch impatience, you put it back on your neck, you catch something, whatever. So know what your teachers like and stick to it. Now that you have your blood pressure cuff, I got mine on Amazon, and the stethoscope was given to me by my friends. This cuff, they come in different sizes, so you want to make sure that you have the right cuff size for your patient. So if you have a child, clearly you're going to get a child cuff. If you have somebody who's really big, then you want to get a larger cuff. So know your patient, know their size, okay? So this one is pretty good because it actually tells you where to put things. So you can actually see here, it says this line right here is an artery mark. So you want to put this where the artery is, this side against the limb. So you know that you put this against the limb. So Okay, so blood pressure cuff on. An artery. Put your stethoscope in. I'm gonna rest this underneath the cuff, just about here. Okay. You have your gauge. Clip that on top. Mine has like a little gray area here that you could just hook it into. So this has the bulb and it has a dial, and this is to let you release the air and close the air slowly. So first test it. You want to make sure that it's open or closed. When it's open, you can actually hear the air like spray out. So I'm gonna pump it. First, close it before you pump. I just want them up a little bit more. You slowly release, and they say at a rate of like 15. Okay. So I couldn't talk at the same time, but I first heard my first beat at 122. I heard my last beat at 74. And when you hear the last one, then you're done, and then you can release it all the way. Now, if you don't get the blood pressure the first time, you do not want to go onto the same arm again and pump it right up again, okay? It's going to give you a false reading. So you want to switch to the other arm, and you try it again. So you listen to the first sound, okay? And then you're going to listen to your last sound. And then you would say your blood pressure. So mine was, I think I said 122 over 74, okay? And that would be your number. So it's important to know your systolic and diastolic, because your teacher may ask you like, okay, so what's your diastolic number? And you can't just say 122. You want to make sure you know. Practice. The best way for you to pass your test is to know your stuff. Practice. Practice on anyone who is willing to let you. I practice on friends, I practice on their children, I practice on some random people, you know, but that's the best way for you to know. So practice, 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 because you never know what situation they're going to give you. The teacher may ask you to do their own blood pressure, so do it.